Let's talk about dog health, man. I called you up the other day looking for some quotes for an article. I actually took it a little bit different direction than just the canine oral health care, but you said so much stuff when we were just talking for a little bit. I'm like, we got to talk about this on the episode. And you brought up periodontal disease, and you brought up teeth care in dogs, and you referenced retrievers a lot. So can we talk about that and just what people, the mistakes a lot of bird dog owners make around their dog's teeth?
Sure. Yeah.
You said something that I've done so much, and I feel like an idiot for this, but you said letting your dog chew on deer antlers or antlers, bad idea, because you can get broken teeth.
Yeah. Labs are big chewers, retrievers are big chewers. They have strong jaws, and we see lots of fractured teeth, especially slab fractures of the fourth premolars, which are like the big tooth there, So they get chewing on that hard stuff, and they'll either break a tooth or knock the edge off of it. And so we'll end up pulling several teeth and retrievers, any dog that has a strong jaw, but just from over aggressive chewing, and I mean, we see it all the time. So we recommend staying away from deer antlers, round bones, long bones, all that hard stuff.
Do you see in addition to the obvious tooth damage that can come from that, do you see any issues with dogs swallowing big pieces of bone?
And that would be less rare with like those types of bones. We'll see them get them stuck like across their bridge of their mouth up in between their top teeth a lot, where it's like wedged in there and we have to knock them out and pry it out, and they're going crazy because it's stuck there and they can't get it out. And we knock them out and then, yank it out of there. So we'll see that pretty commonly. We've seen them with like round bones where they get stuck where their mouth's wide open and they can't open it anymore. It's like come in there, they can't get it out, knock them out and pry it out of there. And then like we talked about the other day, really any bone is recommended against. I mean, like rib bones, chicken bones, man, they eat those and they chew them up and they become like concrete and they reform. And then we'll see huge problems with constipation and, hemorrhagic gastroenteritis and that kind of stuff from those types of bones because they just rip them up as they go through and then it all comes back together like a big rock on the other end,
What do you recommend that people let their dogs chew on then?
I'm a big proponent of dental rawhides. So, there's rawhides out there with enzymes added that helps clean the tooth and coat the tooth and all that. And so as long as they're size appropriate, that's an excellent way to take care of your dog's teeth. Probably, I mean, in my opinion, it's the best way. So rawhide gets a ton of bad press. I mean, you go online and you look up rawhide and they're going to tell you 8 million different ways rawhide's going to kill your dog. I've never seen that. The only problem that I've ever seen with rawhide was one time, a long, long time ago, a dog ate a whole bag in one sitting and all of it gooped right back together in its stomach. And it was just a big old glue ball that couldn't go anywhere. So we had to pull it all out because it was like 3 pounds of rawhide that was all glued together in this dog's stomach,
Mm-hmm.
That's the only time I've ever seen a problem with rawhide. Some people freak out because, the dog tries to swallow too big a chunk and then hacks it back up. I mean, they'll do that, but I've never seen one have an issue with that.
What are people saying is is going to be bad from rawhide then? That's just not true.
Carcinogens, preservatives came from China, came from Mexico. All that stuff, I mean, just all kinds of crazy stuff. And I'm sure, like, we're using veterinary targeted dental rawhides. They're like, I mean, we use them as like brushing your teeth. Yeah, you can probably find some bottom of the line junk that is, cured in formaldehyde and probably not the greatest stuff in the world, but, stick with a Burback or a decent chew. I mean, definitely when it comes to oral health, they're effective. So. And then there's other products on the market like, Mariel or whoever they are now. I think they're BI. I think they're BI now. They've got a product called Orvet. It's kind of like a greenie, but not really. It's really more of a dental cleaner and preventative, whereas a greenie is more of like a xylitol breath freshener type of thing, And so there's some decent non-rawhide chews that are out there, some veggie dent chews that are basically vegetables that help to clean their teeth. And there's different products that are out there, but some of them are, some of the products that are out there that are like that big around and your dog can bite off chunks of it. Well, how big's an intestine? So some of those dog dental chew items are not safe. I mean, I've had to take them out of dogs where the dog chewed off a chunk that was the perfect size to obstruct the dog, and had to go in there and remove, of course we didn't know what it was, and you get in there, you're like, what in the world is this? And you show them a picture, they're like, oh, that's my dog's dental chew. And you're like, are you serious? So I've had that happen. You can't believe the stuff we take out of dog. The craziest thing I took out recently was I took a whole potato out of a dog, and the dog ate a whole potato, didn't chew it, just swallowed it whole. So it came in and it was obstructed, and we get in there and cut it out, and we're like, this is a potato. And the dog swallowed the freaking potato whole.
What, was it a lab?
Oh yeah. So matter of fact, this dog's most accident prone lab I've ever seen. It's in here like once a month or something. If that, it doesn't even go that long.
For eating other stuff and getting it stuck in its stomach or what?
Under the sun. He's a friend of mine. He's got a duck hunting property right next to mine, and I mean, I couldn't tell you what he spent on veterinary bills through the years. It's crazy.
Well, how does a dog come to eat a potato? Did it roll off the counter and he just snarfed it up?
Yeah, she heard it hit the floor, and she's looking around. She's like, she forgot about it, And so a couple of days later, the dog's puking, and we're like, oh, we don't know what it is. So we took it out. We're like, here's your $1,800 potato.
What else? What else have you taken out of dogs?
Oh, I mean, corn cobs, panties, unidentifiable objects, towels, bras, tampons, everything, socks, rocks, Gorilla Glue, everything you can imagine.
How often in the wild ones how often does the owner know, or how often is it where it's just they're like the dog's way off and we got to look?
Almost never. I mean, they usually don't know. Like I forgot the other day, had a lady call me and she said, hey, I was playing with my dog and I threw the tennis ball and the dog came back and there was no tennis ball. I think it ate it, swallowed it. I'm like, well, I mean, it'd be easy to figure out. I mean, we just got to take an x-ray. So we took an x-ray and sure enough, there were 2 whole tennis balls. She didn't even know about the other one. Who knows how long it'd been in there. 2 whole tennis balls in the dog's stomach. They had not been chewed, like brand new. So, she had no idea about the first one. The second one, she was like, I looked everywhere and I couldn't find it. I think the dog ate it. You're right, because here's the x-ray. There's 2 of them in there.
Little did she know he's been eating tennis balls all week.
Yeah. I'm like, you might want to get rid of anything the dog can swallow. You ever heard of a basket muzzle?
Well, you hear about the nightmares with tennis balls a lot, getting chewed up and then them swallowing parts of them and then getting blocked up. But a whole tennis ball is a different story. Let's veer back to the oral health thing quick here, because we didn't touch on something. We talked about the broken teeth and it led us down that path, but periodontal disease is very, very common too. And people aren't, I would say generally the average pet owner is not looking for that.
Sure. So there's a few factors that go into that. I mean, just like with people, one's genetics, right? So some dogs are going to have better teeth. Some dogs are going to have worse teeth. People brush their teeth twice a day. No dog owner brushes their teeth twice a day. So I'm a big fan of things that are easy that you're going to do anyway, or the dog's going to remind you to do. So like, let's say you're giving your dog dental rawhides. Well, that dog wants its dental rawhide. So it's going to be like, when you're getting ready for bed, it's going to be like, hey, where's my treat? So that's helpful because they help you remember, and it's easy. It doesn't take any of your time. So I'm a fan of, preventative treats that are easy for the owner to give. So when it comes to gun dogs, a lot of gun dogs are good chewers. So let's say you have your lab at home and he goes out in the backyard and finds a big old stick to chew on. Well, sure, he could break a tooth or get a splinter up in his gum or whatever, but the action of chewing on that stick is going to help to clean his teeth. And so labs that live at home in a yard and are part of the family, We surely see some periodontal disease in those dogs, but generally going about their daily business of chewing on a Kong and chewing on a stick and getting an oral treat here and there, they're going to have pretty good teeth unless they break one, you know. Where we really see the problem is in more hardcore kennel dogs. So dogs that, you know, kind of live at the trainer or live in a kennel at home and, you know, the owner lets them out to go pee in the morning, airs them in the morning, maybe gives them a little exercise, feeds them. They stay in the kennel the rest of the day. The owner airs them in the afternoon. They run around. They go back in the kennel, and they're not really chewing on anything. They don't have any treats. They don't have any toys. They don't chew on sticks. And we see a lot of periodontal disease in those dogs. So like we were talking about, we go on a big, you know, we work for several big kennels, and we'll just go through once a year and do all their annuals and their pro heart and give them the exam and do all that stuff. And, you know, those dogs have terrible teeth compared to an individual's lab that lives at home, you know, and it's just a lifestyle difference, you know.
Well, what are we looking for though? If somebody's sitting there and they got a 4-year-old GSP or a lab at home, what would they see if their dog had this?
Well, I mean, it all starts with tartars. So, I mean, you know, their teeth just like ours should be nice and white. And so, you know, tartar will start accumulating, and then it becomes calcified. And so it becomes like a brown or tan coating that's over the tooth. And so in the beginning, you know, the teeth get covered with that, and then it starts to expand and it grows up into the gum line and then up into the bone. So periodontitis is, you know, infection and inflammation of that junction of where the bone and the tooth and the periodontal ligament and the gums and all that stuff lives. So once you start to get an infection up between the tooth and the bone starts to rot away, then that's when you start to get into teeth that need to go, need to be pulled, need to be excised, all that. And then, of course, along with that comes all the other life-threatening conditions like, you know, heart disease, endocarditis, kidney disease, liver disease, bloodborne infections, all that type of stuff that's directly associated with, you know, poor oral hygiene and oral health.
How often do you see it progress to that level in dogs? Often?
Oh, every day.
Oh,
Yeah. Yeah, the number of dogs that are out there with just severely advanced dental disease is huge. So, you know, in a perfect world, we would like to try and head that off at the pass. You know, different veterinarians make more strong early recommendations than others. So, you know, some doctors are more proactive and some are less. So, and we have the gamut among our practices, but, you know, certainly it's important. And, you know, it's easy to see. It's not like you have to have a veterinary degree to lift your dog's lip up and go, God, this is a daggone mess. Stinks. It's brown. Gums are red. You know, I mean, that if you see that, that's not a good sign.